Thank you for the introduction. I'm Alastair from Owlstone Medical, and as Billy mentioned, I'm an Owlstone Engineering Fellow, which means I get to work on novel technologies and look at how we can apply them to breath analysis. This presentation is about the development of one of those novel technologies, which is a collaboration between Owlstone and Boehringer, looking at the breath collection of intubated mice. This collaboration was initiated after Boehringer approached us about the feasibility of collecting mouse breath whilst their mice were undergoing lung function tests during an intubation procedure. Kerstin from Boehringer is going to talk to you about their target application and why biomarkers are of interest to them. And then I'm going to talk to you about how we went about creating a breath collection system for the mice, give an overview of the baseline performance that we have achieved. So I'll hand over to Kerstin now, who's going to talk about the application.
Thank you, Ali, for the introduction. My name is Kerstin Geillinger-Kaestle, and I'm head of the in vivo pharmacology group in Biberach in respiratory. We are trying to enable drug discovery for respiratory diseases with a focus on translatable biomarkers. Especially, we are interested in interstitial lung diseases, which present a really high burden for patients. Interstitial lung diseases can be grouped, as you can see here, by their cause, either, for example, exposure-related drugs, for example, like chemotherapy can induce interstitial lung diseases, but by stopping, basically, taking the drug, you can get the lung to recover. Then you have in the middle the autoimmune-related diseases like rheumatoid arthritis or scleroderma that also can have a lung involvement. On the right-hand side, you see the group where the cause is actually unknown. That's why it's called idiopathic. One of those is the IPF, the idiopathic pulmonary fibrosis, and this disease is really devastating and has also a very high mortality because of the very strong fibrotic remodeling of the lung. And this is also what you can see here on this slide. On the right-hand side, that's the histological section of an IPF patient. And if you compare it to the left-hand side, that's a section of a healthy lung. You can clearly see that you don't have that many air-filled spaces, the alveoli left, but a very high proportion of dense material that is actually fibroblasts and deposited matrix. That makes the lung really stiff, and therefore the patients have a hard time to breathe. To actually develop those new therapeutic concepts, we need biomarkers that can really link throughout our assay systems towards the clinic. On the right-hand side, you can see how it all comes together. We start with the patient. We do our target validation in human primary cells, do a species translation, and then the in vivo trials for the verification and the human dose estimation in vivo. To link it all together, we were thinking about which matrices or samples would be actually available in clinical trials and which of those would be actually really directly linked to the lung. And that's how we came to the volatile organic compounds. And that's also when we started to dig more into literature on what is already known and what's possible. And we clearly found studies already that VOC profiles in human breath can really differentiate between IPF patients and healthy. Therefore, we asked the question whether we can really utilize VOCs measurements for the translation between our preclinical animal models and the clinical trial. That's where we also started to look for partners to develop a device to measure VOCs in our preclinical animal models. And with Owlstone, we found a really good partner to make this great step. And Ali will now present what we came up with.
Thank you, Kerstin. So, Boehringer approached us at Owlstone to see if we could do VOC analysis on mouse breath. This isn't something we had done a lot of work on previously, but we could certainly see that it had a lot of utility in the breathomics field. So we're really excited to have a look. When Kerstin talked about the actual intubation process that they use, we saw an opportunity to get some really high quality breath samples from the mice. So we were getting a very direct sample from the mouse lung itself. So we took up the challenge to collect these breath samples from intubated mice with the ultimate aim of finding breath biomarkers that could be used in the drug discovery pipeline. The first stage of this work had two major steps. First was to ensure that we could modify the ventilator setup that was currently being used so that we could collect breath VOCs with it. The aim here was to ensure that the background levels of the VOCs going to the mouse were as low as possible, and then collecting all the breath being exhaled by the mouse with minimal losses. The second step in the process was to baseline that performance of this breath collection system in order to understand what potential it could have. To do that baselining, we wanted to compare the number of on-breath compounds that we found in the mice to the number that we typically find in humans. So we had our basic building blocks. We had a FlexiVent ventilator, our standard sorbent tubes, and we have some mice. And then we had to have a look and see what we could come up with. This is the arrangement that we settled on. Now the FlexiVent ventilator is a great bit of kit. It controls the airflow into and out of the mouse, and it monitors the pressure whilst doing that. And this makes the system design really quite simple. So all we have to do is clean up the air delivered to the mouse and then tap into the exhaled breath line to capture the VOCs. So what we did is we put in a large VOC filter here on the inlet to the FlexiVent system. So this removes any contamination in the laboratory itself, and it provides a nice constant input into the FlexiVent itself. We quickly discovered that the FlexiVent actually does outgas. It produces quite a lot of VOCs due to the air control systems that are inside of it. So then we added a smaller VOC filter here to the outlet of the FlexiVent. Now this had to be quite small and have a really low pressure drop, otherwise the FlexiVent control software would think there was an issue when it was doing its self-checks. So this air would then flow down out of that filter into the mouse and then out of the mouse where we had a sorbent tube on that return line back to the FlexiVent. So we're keeping it as close as possible to the mouse to reduce any hang-up or condensation of components out of the airflow prior to being collected on that sorbent tube. The first set of testing that we did on this system was without any mice present. It was just looking at the quality of the background of that air that would be delivered and captured by the setup. So the graph on the right here shows the total mass of VOCs collected onto sorbent tubes. It's all plotted relative to these control here, which is preconditioned blank, or what we could refer to as blank tubes. Now what you can see is that at point A, in the lab, we're seeing around about 3 times as much VOCs relative to our controls. So that's pretty normal for laboratory conditions. As the air passes through the filter, the amount of VOCs are reduced quite significantly down to levels that are quite comparable to the controls. However, as the air then passes through the FlexiVent and out again, we see that a lot of VOCs are added back into the airflow. So then that second little filter here is used to reduce the VOC content right back down again to the sort of levels that we are seeing in the controls. Now we had to do additional testing on on this setup to make sure that we were getting the right sort of flows and pressures that are needed in order to intubate the mice. That did require a little bit of modification to this flex event filter here, just to really get that pressure drop down. But in the end, we have come up with a system that gives us very low contamination levels, whilst also still being able to carry out normal mouse intubation. Now, intuitively, I'm sure that everyone can see that clean background is essential for forming good breathomics. But I want to quickly highlight how we apply those metrics for evaluating the performance of the system, where you can see how useful it is to have a clean background. Any assay will have a variety of sources of background noise, including background introduced while the sample is collected, but also when it is shipped and stored and analyzed. Here I am showing two example VOCs. The first one is isoprene, which is very commonly observed as a breath VOC, and the second is 1-butanol, which is used in many consumer products. In this example, both compounds can be quantified on the breath sample and also on the system blank, created by sampling ambient air in the room. But only isoprene is distinguishable from background in these samples, and therefore we consider it to be on breath. Being able to identify the suite of on-breath compounds in a sample set is essential to be able to interpret the data set. We therefore use the number of on-breath compounds found as providing an indication as to how useful the data set may be for untargeted discovery of biomarkers. We've devised 3 statistical tests for determining the number of on-breath compounds. We routinely use these to evaluate our system performance. Very briefly, the 3 methods are standard deviation. Here we look at the mean and standard deviations of the VOC in the equipment blank and only consider the sample VOC to be on breath if it is more than 3 standard deviations of the blank plus the mean of the blank. This then has to occur in over half the breath samples for us to consider it to be on breath. Second is a paired t-test. This method is possible when we have a blank that can be matched to a breath sample, because it has been taken directly before or after the breath sample. In this situation, we perform a paired t-test between the blank and the sample, and consider the VOC to be on breath if the result of the t-test gives a p-value of less than 0.05, and we also have a fold change of at least 2. Finally, the third method of determining on-breath VOCs is to use the ROC-AUC curve. That's a receiver-operator curve, area under the curve. An AUC of 1 would mean that the data is perfectly separable between the breath and the blank, whilst an AUC of 0.5 would mean that the separation is random. We use a threshold of an AUC of 0.8, and anything above that is considered to be on breath. So keeping in mind these on-breath metrics, we performed a trial which compared our standard OmniBreath platform used on humans to this mouth breath collection system. By looking at how many on-breath compounds we find on the mouse samples compared to an equivalent data set in humans, we will get an idea of the utility of this method. So what we're looking for is as many signals as possible that look like this, with a good high on-breath component, and hoping to not see too many of these where the on-breath component is indistinguishable from the background. So this gives you the setups that we used. So at Boehringer, we had a trial which ran over the course of 4 days, where the mice were intubated and their VOCs collected all on a single system. Here you can see the setup. In all cases, we formed a system blank prior to each mouse collection, and we also collected some ambience as well to see what was going on in the laboratory. Prior to the intubation, the mice were placed in a cage that had clean air going into it, and this was to try to remove as much background as possible from the mouse's lung. Also, the flex event was set up to perform what's called a deep lung inflation every 2 minutes. This is where the lung is inflated as if it's doing a deep breath, and the idea being to try to get into the depths of the lung and to get as much of the VOCs out as possible. We also put the mice on the intubation for 5 minutes before we started doing the breath collection. This was again to try to flush out as much background as possible. The collections themselves took 45 minutes and we're collecting around 1.8 litres of breath. All the air from the mouse is collected in these situations. So what you can see, just to run through, is that the air comes out of the flexi vent through this filter. It goes down to where the mouse would be, and it comes back up again through the sorbent tube and back into the flexi vent. We also did in parallel to this a human breath sample collection, trying to keep it as similar as possible to the mouse collection. So again, it was run over 4 days. We managed to get 13 people in total, and we performed a system blank prior to each of the collections, as well as some ambient blanks. We collected that in our breath biopsy centre here at Owlstone, and we were using healthy volunteers and asked them to just perform normal breathing patterns. The collection time for this is shorter. It's a 15-minute collection time, and in that time the receiver will collect around 2.5 litres of air. Now the receiver then is also configured to exclude air from the upper airway. It actually intakes a sample of the breath that is being breathed out, and what it's trying to do there is it monitors the breathing and tries to capture as much as possible from the lower lung. This is a fairly typical setup that we use when trying to do biomarker discovery. Once all the samples were collected and brought back to Owlstone and put through our standard Omni pipeline, the samples are purged, internal standards are added, and the analysis is performed on a TDGC orb trap. Then the data is analysed using our standard in-house extraction techniques. The output of this process is a feature table of VOCs, along with tiered identification of the compounds. Tier 1 are the VOCs we're most confident in. These have reference standards that are run at a similar time. Tier 2 compounds are part of our high-resolution accurate mass library that is specific to the instrumentation that we use. And Tier 3 are the IDs from the external NIST library, which have a variable match factor, depending on how good the match appears to be. Now, to give you an idea of the data, this is a trace of the total ion current output from the mass spec. This doesn't show that mass to charge information, but it gives an idea of the type and intensity of compounds that are elucidating from the GC. The black line is a system blank, and the blue line is a mouse breath. First glance, they do look pretty similar, but if we zoom in a little, you can start to see the peaks in the mouse samples that aren't there on the system blanks. I've highlighted a few of them, some of the more obvious ones here. Now, just looking at these things by eye is not really the way to do it. So what we do is we then apply those statistical tests that I described earlier to determine whether these compounds can be considered to be on breath or not. So these are the 3 tests, and if we run through those, we get results for the number of on-breath compounds that we see in the mouse samples. You can see that there are between 24 and 65 compounds, depending on the type of test used. If we compare that to the human samples, we do see more compounds in those human samples, but the pattern is very similar across the 3 types of tests. So we do certainly see less on-breath compounds in the mice than we do in the humans. That's not really that unexpected, given the size and physiology of the mouse. And also, this is a new technique. We haven't had much of an opportunity to really go into it and optimize as much as possible. We're also seeing good overlap between the compounds found by all three methods. If you look at the data set as a whole, there are 77 unique compounds that are found to be on breath in the mice themselves. This chart gives an overview of all the compounds that are identified in both the mouse samples and the human samples combined. They are plotted as a fold change against the corresponding blank samples. Fold change in mice is shown on the y-axis, and fold change in humans is shown on the x-axis. They are also color-coded by the on-breath status. Those in cyan are found in both humans and mice. It's reassuring that we see a significant number of these, giving us confidence that we are seeing real biological signals in the mice. There are also some compounds, which are shown in orange, that were only found in the mouse samples, something that's pretty interesting. There's also dark blue, which were only found in humans, and black are the remaining off-breath compounds. Now what I'm going to do is I want to show the detail of 4 of these compounds, give you a little bit of an idea of the sort of data that we are looking at. So the first compound that I want to highlight is methyl nitrate. That's a tier 3 identification, so it's found in the NIST library. And this is one of the highest intensities that we saw in the mouse breath. You can actually see it in both humans and in mice, but it certainly is much more significant in the mouse. So if we look at the plots, if you look at the plots along here, the ones that you really want to keep your eye on are looking at what you see in human breath versus the human blank, and then what you see in mouse breath versus the mouse blank. The red line is the threshold for determining on breath in the mouse, and the blue is for humans. So as you can see, certainly very significant. This compound does have potential association with ketosis and oxidative stress. Second compound I want to highlight is 2-butanol. And this is a tier 1 identification, so we're very confident that this is the correct compound. And this one again has a very high intensity in the mouse breath and much lower intensity in the human breath. So much so that actually in this particular trial, we did not consider it to be on breath in humans. There was too much overlap between the breath and the blank. You can see very clearly that it is significant when you look at the mouse breath and the mouse blank. Third compound to look at here is TMA. Again, seen in both humans and on mice. We're seeing quite a large signal in both of them. It is quite variable, but it's certainly looking significant above the background. This compound can often be produced in the gut microbiome and is actually associated with cardiovascular disease, so it could be certainly one of interest in the future. Final compound that I'm just going to highlight here is dimethyl sulfone. That is again found in both humans and mice, but I've actually switched to a log plot now on this side here, because what we're seeing is that in the human breath we're seeing a significantly large signal compared to the blank. In the mouse, it's certainly above the noise, it's certainly above the blank itself, but it's nowhere near as intense as we're seeing in the human sample. I wanted to highlight this one because that's actually a bit more typical of the on-breath compounds that we're seeing. So we find in the mice, the signal is low, but also I think helped by the fact that the background is very low, we are still able to pull them out and determine that they are on breath. That was just a whistle-stop tour of some of the compounds that we're seeing on mouse breath, and brings us up to where we are today in this project. So in summary, we've managed to modify a mouse ventilator to collect breath and provide a very clean background. Because we can control the environment so well, we're ending up with clean blanks and much cleaner than our human studies. And this is allowing very small signals to be extracted from the background. We're seeing genuine signals on the mouse breath, as shown in the whisker plots, and there is overlap with human samples. We have identified some known biologically relevant compounds already. That said, we do not see as many compounds as we do on human breath. I think that's to be expected, given the size of the mouse and its lung. But also it's early days yet, as we've only collected this one set of data on healthy mice. That brings me to my final slide about what we plan to do next. There are two components to this. Firstly, we are going to move on to address Kerstin's main aims. That is to look for biomarkers in mouse disease models, in particular looking to see if there is a biomarker response to drug treatments. And secondly, we'll be looking to improve the entire workflow further, try and get those background levels down even lower, increase that breath signal, and improve our standard data analysis. Indeed, the feature extraction that we were using has been optimized for human samples. For the mice, we believe that we may be missing some of those smaller signals that we could actually pull out from the cleaner background. And finally, we're interested in looking at other animals. Rats would be an obvious choice as a next step, as they should give us an improvement in the signal, but due to their larger size. But we could also look at other animals as well. So thank you all for listening today, and a big thank you to Kerstin and her team at Boehringer Ingelheim. This has been a great project to work on, and I'm really looking forward to the progress that we're going to make over the next few months. Thank you all again, and we are now going to open up for any questions.
For the wonderful talk there. So we've got some time for questions. Quick reminder for everyone, posted in the Q&A at the bottom of the Zoom tab there. First questions come in relates to the choice of the intubated model. So why in an intubated model as opposed to animals in a chamber or where you have animals in a cone, for instance? Not too sure who, Kerstin, if you want to try and tackle that one, maybe.
Okay, I can start with it at least. So yes, obviously you could also do it in a cone, but then the animals would be fixed, and we all know that stress is not basically the best thing that you can do to an animal, especially if you want to get like a real signal that you can afterwards really use as a biomarker. That's why we decided actually quite soon against this option. We also discussed about the chamber, how that would work. But as we would be hoping that we could also include it or link it to lung function measurements, then we came to the idea that maybe it would be a good idea to do it straightforward on the Flex event. Then we could have lung function measurements, but also measure basically the biomarkers, which would be awesome to have it directly linked.
That makes a lot of sense. Ali, anything to add there, or is that covered up?
Yeah, well, I think I'll just add to it the there's always the issue with background contamination, and by doing the ventilation, you are really sampling as pretty much directly as you can from the lung, whereas in the chamber you're going to get contamination from the fur, urine, feces, parts of the chamber itself as well. And I think that's particularly challenging in something like a mouse, where we do expect the signals to be very small because they obviously have small lungs.
Yeah, and that kind of leads on to the next question. So looks like the concentration levels are lower and there's fewer on-breath compounds. Do you think the whole explanation just relates to the concentration levels, or can you infer something about the presence or absence of VOCs that may be present on human breath because of exposure-related events? So compounds that are actually on breath, but maybe from exogenous origin, versus the mouse, which may not have exogenous exposure through diet, broader exposure compounds as well. I was wondering if there's any kind of thoughts on the explanation for why there's fewer compounds.
I'll take this one if you want, Kerstin. I think there's two aspects to this. I think the first one is that sensitivity issue. We are going to have, we said, the mouse has much smaller lungs. And I think that's always going to be a problem, but I think we can start working towards that. This has been the first time really we've looked at this, and I think there are a number of areas that we could do to improve it, to try and eke out more signal. But I do think I agree with you on your point about exogenous compounds. All these mice are kept in very well controlled conditions. I think probably much more controlled than humans would be. So you're going to see a lot less of that variability. So it could well be that the conditions they've got there mean that you're not seeing so many of those extra compounds. I will say actually during some of the early testing we did see some issues with some of the anesthetic gases that were used in the laboratory. Those were starting to show up, and we actually took precautions to make sure the mice were kept in a really clean environment to eliminate those. So actually during the testing we were trying to remove as many of those external factors as possible.
Brilliant. The next question, I know it was touched on very briefly at the end, but what's the kind of plan next in terms of studies where the model can now be run? Maybe Kerstin, that's one for you.
So we already started on the next bit, basically to really see if we can observe changes between non-diseased and diseased animal models. And during the talk I already mentioned, we are very much interested in lung fibrosis. That's why we used an AAV TGF-beta model where we induce fibrotic remodeling. And also here we already included a compound, so a treatment, to see also if we not only get basically the fibrotic remodeling signature, but also if it's possible to see changes upon treatment. I think the analysis is currently ongoing, and then hopefully towards the end of the year we can conclude something on this question already.
Brilliant. And that kind of leads into, we got time maybe for two. The next question follows on from that. So where you're dosing drug into the animal, does that then mean that you could also consider using exogenous probes, which have been described in liver disease, lung cancer work as well in this model? So a probe for diagnostic purposes, as opposed to just relying on the on-breath or endogenous compounds for the animal. I don't know, Ali, maybe you might be best positioned.
Yeah, I think absolutely you could, and I think then you start tackling some of those signal issues as well, because if you know the compound that you're actually looking for, you can tune the system much better to be able to look for them. So yeah, if you can target it with a probe, either directly administered or through diet, etc., then absolutely, you know what you're looking for. Be much easier to extract that information and characterize it.
And does that help with some of the background VOC issues then, if it's unique?
Yeah, especially, I mean, if it was labeled as well, isotopically labeled, that would make it very simple for the mass spec itself. But like I said, once you know exactly what it is, you can start to you can adapt your pipeline to suit.
Brilliant. And the last question we've got time for is, has this been published yet? Maybe Kerstin, for you?
Not yet, but we are really on it and pushing it forward. So keep looking at literature, basically. There will be something coming out soon.
Excellent. Well, thank you so much again for the time today. I really appreciate it.